Marks International Day of Action for Women's Health. 13 leading civil society organizations will launch the second phase of the hashtag My Body, My Choice campaign. It seeks to end the stigma around abortion and affirm a woman's right to make choices about her own body, health and her life. The campaign comes at a time when the US is restricting rights and abortion funding worldwide. Let's talk about this campaign some more now. We're joined by Amnesty International's Susan Tolmay to tell us more. Susan, good morning.
Morning.
Now we understand that the first phase of this campaign was launched in September last year.
Right.
What's been the progress? What have you managed to do in that time, in the past couple of months?
Well, we've had a petition and we're encouraging people to sign our petition to stop stigma against safe and legal abortion. We've been collecting personal stories. We want to hear from people who have an experience, abortion service providers. So we're really gathering momentum around this issue.
Well, just looking at some of the figures that the campaign has put out, it says an estimated 13.6%, or that's 1 out of 7 women in South Africa, have an unmet need for family planning. What do we mean by that?
It means that contraception in medical facilities is sometimes not available. It means that women cannot or do not know that they can access safe and legal abortion services at public facilities.
Are we finding that this is concentrated in certain parts of the country? Are we finding that it's mostly in the outlying areas? Where are we seeing more of this happening?
Well, it's obviously more difficult in the more outlying areas. If you live in Johannesburg or Pretoria, you have a lot more access to public facilities that are more likely to offer abortion.
The cities.
The cities. In more rural areas, we found that women have to travel very far distances to get to a clinic. Often the closest clinic doesn't provide abortion. We spoke to a woman in Mpumalanga recently who have to travel 46 kilometers to get to their closest clinic. That comes at a cost, their lack of ambulances, so their needs aren't being met.
So you say you've collected a lot of stories like the one you just told us about the woman from Mpumalanga. Susan, what's the impact of women not knowing what their rights are, not knowing about the law, and being faced with all of the, the perceptions around making choices around their bodies and making those, they are difficult decisions. They're very difficult decisions to make, but sometimes they are necessary. What has been the impact on their lives and the country as a whole?
Well, what happens when women can't access safe and legal abortion in a medical facility where the procedure is safe if it is done by a trained medical professional and in sanitary conditions, what happens is women seek unsafe abortions. And unsafe abortions can often result in injury and sometimes death.
So, I mean, we mentioned in our intro just what's happening in the States at the moment and the entire uproar. What's it, 15 states in the US now banning abortions and tightening also when it comes to funding and where the money goes. How much of a setback when a place like the US, when we find states in the US making decisions like this, making this a law, we can't say it doesn't affect our perceptions here because we go, oh, well, if America's doing it and they say, this is what it is, maybe we should rethink our perceptions of this. What's the impact of things like that on us here?
Well, I think the conservative pro-life lobby in the US is quite dangerous. They're very well organized, they're very well funded. I think it's not just states implementing more strict abortion laws, but when Donald Trump came into power, he signed the global gag rule. And what that means is that no organization based in the US can fund any organization across the world that offers any kind of abortion services. And that has had a grave effect on women's rights organizations who offer even sexual reproductive health information. It even started to affect diseases like Zika and malaria and HIV/AIDS. So it has had a long-term impact on women's organizations.
Well, the funding is the one thing. Knowing about the law, knowing about your rights is another. But there's also the other aspect of the, Susan, when it comes to cultural, religious beliefs and you know, just discrimination on that level.
Yeah.
And that, I'm guessing, might be a bigger part of the challenge in getting women to understand that, yes, you know, despite your religious beliefs or what they say, when it comes to your body, you have a choice. Is that proving to be?
Well, you know, the stigma goes, it cuts across. You know, young women are scared to go to health facilities because nurses abuse them, tell them that they shouldn't be pregnant. So that's where it starts. They don't want to tell their parents. So often they don't want to go to public health facilities, which means they access unsafe abortions. Religious beliefs are also used by healthcare professionals who refuse to conduct termination of pregnancy, and that's called conscientious objection. But it's not catered for in the law, so it's not regulated.
Yeah. And how do you take somebody to task for that? For saying that
exactly,
you're trying to make a choice. So the second phase of the campaign being launched, what does it entail?
The second phase is a bit of an extension of the first phase. So we will carry on with our petition. We will encourage people to take action. We also will carry on collecting the stories of people who've had to access abortions and of service providers, so that we can really start to break down stigma and start to put this issue out into the open, to say it's a healthcare service that often women need for various reasons, and they have the right to choose that. They have the right to choose if and when they want to have children.
Well, thanks very much for that. That's Susan Tolmay from Amnesty International, just chatting to us about the campaign. That's the hashtag #MyBodyMyChoice.